Hi, I'm Samantha and I'm doing my IV video for the drug Amiodorone. My scenario is of a patient named Pat Smith. He's 59 years old and he's been admitted with palpitation and chest pain. So the doctor has ordered Amiodorone 150 milligrams rapid loading dose stat and Amiodorone 360 milligrams IV slow loading over the next 6 hours. So I've got a syringe to draw up 3 mils of air, and I need to clean my Amiodorone jug, and then inject that air into here, and draw up another 3 mils of the drug, because that's going to be put into an IV bag with 100 mils um, of normal saline or D5W. But before I can do that, I need to have a second RN double check this. She's confirmed that it's okay, so we've got our 5 rights out of the way. We've got the right patient, Pat Smith, the right drug, Amiodorone, the right dose, 3 mils injected into 100 mils of normal saline or D5W. We've got the right route, which is an infusion, and the right time, which is stat. So I'm going to inject this in here. And that can be discarded now. My other one is a pre-mixed bag for the slow loading dose, so we don't need to worry about that because that's already ready to go. Okay, and I'm also going to double check with my IV drug book that it's appropriate to give to my patient. The usual dose says rapid loading infusion, 150 milligrams, specifically diluted to 1.5 milligrams per milliliter over 10 minutes, so that's correct for what the doctor's ordered. And slow loading infusion of 360 milligrams, specifically diluted to 1.8 milligrams per milliliter over the next 6 hours, so that's perfect. And also, some of the antidotes available are vasopressors, inotropic agents, and volume expansion, so those would be good to have on hand. And the precautions, the only thing really is that it's contraindicated in patients that have had corneal refractive laser surgery, but I don't think we need to worry about that with our patient Pat. Some of the side effects are hypotension and pain at the IV site, so we'll be monitoring his blood pressure often and teaching him the signs to report if he's got any pain. So my drug is compatible with the D5W that's already hanging in the room, so let's go in. Hello, Pat. My name is Samantha. I'm your nurse today. I hear you've been having some chest pain. Can you rate your pain on a scale of 0 to 10, 10 being the worst? Okay, so he tells me his pain level and the type of pain possibly. I'm going to wash my hands. We've also got a label made up to put on this staff dose, so we don't get confused. Alright, and I'm going through my last 5 rights. Pat, can you tell me your last name and your date of birth? He tells me Smith and December 18th, which is matching sonogram. He's got a PICC line in place, so that's what we're going to be using, this hub right here. And we're ready to go. I'm going to clean this for 30 seconds. We can connect our drug. Make sure that the roller clamp is open. And hang that up. And this will be piggyback at 618 milliliters per hour. The volume to be infused is 103 mils. And that gives us 10 minutes, which is what is ordered. So we can go ahead and start that. And then once that's been, and also lock the safety on the back. And once the 10 minutes is up, we can disconnect that. Clamp it again. Discard of that. And next is the full loading dose of Amiodorone, 900 milligrams in a 500 milligram bag. But his order is for 360 milligrams, so that ends up being 200 milligrams or 200 milliliters to be infused. So again, clean the hub, 30 seconds, and connect our next medication. And make sure that everything is unclamped. And set our infusion rate for 33 mils an hour. And the volume to be infused was 200 milliliters. And that ends up being 6 hours and 3 minutes, which is just perfect for what was ordered. So we can go ahead and start that and lock the safety on the back again because that'll be running for quite a while. And also teach Pat, if you've got any pain, swelling, redness, or itching where your IV is going in, make sure to let one of the nurses or doctors or someone know what's going on so we can take care of that right away. And we'll also be monitoring your blood pressure every 15 minutes or every 30 minutes to make sure that it's not getting too low, because that's the side effect of this drug. Okay, well, my patient is set, and hopefully he'll start feeling better.